Well, he became a regular fixture on our TV screens through daily health updates during COVID-19. But Professor Brendan Murphy is ready to retire after leading the Department of Health and Aged Care through the pandemic. The former Chief Medical Officer was appointed as Department Secretary in 2020. Health leaders around Australia praising him as he prepares to step down mid-year. Professor Murphy joins us live now from Melbourne. Brendan, really appreciate you making the time. Thank you so much. You really did become an accidental superstar of sorts. You're a household name now thanks to COVID. Just give us a bit of an insight into what it was like for you to be on the front line of our response. I mean, it must have been pretty frightening being in charge of such big calls with such an unprecedented set of circumstances.
Yeah, it was a very heady time in early 2020. I have to say, I wasn't alone. I had this wonderful group of people, the Australian Health Protection Principal Committee, all the state and territory chief health officers and a range of experts who were providing the ever-changing clinical advice to our governments at that time. And that committee met every day for the first half of the 2020, and we were rapidly changing. It was an extraordinary period. We were working 18 hours a day. We were trying to understand what the virus was doing, where it was going. We didn't know whether we'd have a vaccine. We took very important decisions, governments did on our advice, to close borders, introduce hotel quarantine, and to do those public health and social measures, which were highly contested, and we had to balance, the risks and benefits. So it was an extraordinary time, really, and people often ask me how I felt about it. Well, we didn't have time to stop and think about how you felt. We just kept on going at that time.
Well, fame can have its downsides. I assume not everyone was a fan of yours as you made those contentious decisions as you described them there. Did people get nasty at any point? Were you one of those public figures who had to put up with death threats and harassment outside of work?
Not really. I mean, we all got some... there are a group of people who are philosophically opposed to vaccines, who often share their views and have emailed and sent messages, and we find them in all walks of life. But most people, I found, the media and the public, were very, very supportive of what we were doing. I mean, there was a range of views. I mean, we all know, there's as many epidemiological opinions as there are epidemiologists, and there are people out there, who early in the pandemic and even today who say, we should have gone harder, or we went too hard, or we did this thing right or wrong. But I think the fact that we've got people on either side of the spectrum who say we could have done things differently probably means we got it right by being somewhere in the middle.
Do you have any big regrets? Is there any decisions that you wish you could go back in time and look at again?
Overall, no, I think the advice we provided and the decisions made by our governments were pretty sound. I think the data supports that. We had one of the lowest death rates, particularly in that early pre-vaccination period in the OECD. We'd had similar countries like the UK had much, much higher death rates than Australia. And we had we ended up with one of the highest primary vaccination rates in the world. So I think overall we did well, and that in large part was due to the way the Australian public, turned up to get vaccinated and did the right things. So the government is committed to doing a deep review of our COVID response. They've also committed to introducing a Centre for Disease Control to make sure we're better prepared. And of course, there will be things in that review that we will identify that we could have done better. But nothing stands out as a significant failure in advice. I think there are some things, I was reflecting earlier today in another interview, that I think we underestimated the complexity of getting vaccines into aged care and disability sectors, which are some of the hardest sectors to get vaccinations. So if we did that again, we would probably do that in a different way. But overall, I think we did pretty well.